When they told me they wanted to do a biopsy, naturally I was concerned. It's unnerving to think that something can be wrong. But everyone was so comforting and reassuring, and the procedure itself was fairly simple. I was in and out in a matter of hours, and I don't remember any pain. And I felt fine that afternoon and was back to work the next day.
No one wants to hear that they need a biopsy. But in the vast majority of cases, 80% as a matter of fact, the biopsy delivers good news. The lump or lesion is not cancer. Of course, we have to be sure. That's why your doctor has scheduled an image-guided breast biopsy. Rest assured, you're in good hands. Your biopsy will be done at Saratoga Hospital's Breast Health Center at Wilton Medical Arts. That means you'll receive the best possible care, state-of-the-art equipment, accurate results, and a team of highly qualified professionals who understand what you're going through. An image-guided biopsy is exactly what its name suggests, a procedure that uses computerized imaging equipment to pinpoint the area where the sample tissue, or biopsy, will be taken. The biggest advantage of an image-guided biopsy is that it's a minimally invasive procedure, done right at Wilton Medical Arts instead of at Saratoga Hospital. The procedure requires a small incision and is performed with local anesthesia. That means you can expect to recover quickly and have only a small scar. Our Breast Health Center offers 3 types of image-guided biopsy: stereotactic, ultrasound, and MRI. For the most part, the procedures are the same. You also should not take non-steroid anti-inflammatory medications, such as ibuprofen, for a week before the biopsy and 24 hours afterward. The day of the procedure, have a light breakfast. If your doctor prescribed medication to help you relax, take that an hour before the biopsy. Arrive at Wilton Medical Arts a half hour before your appointment time, and make arrangements for someone to drive you home afterward. We've printed these instructions for you so you have them for easy reference. The procedure will be done either by a radiologist or by a radiologist and surgeon together. It will take less than an hour, and throughout, we will tell you what's happening. We'll also walk you through it now so you know what to expect. First, to prevent infection, we'll clean the general area where we expect to make the incision. Then, we will pinpoint the exact location using ultrasound, MRI, or stereotactic equipment. For a stereotactic biopsy, you will lie on a table on your stomach with your breast positioned through an opening in the table. Your breast will be compressed much the way it is during a mammogram, while a computerized mammography machine takes images to locate the suspicious area. For an ultrasound-guided biopsy, you will lie on your back. For an MRI-guided biopsy, you will lay on your stomach, and we will insert an IV so we can inject contrast to make it easier to spot the lump or lesion. Once we pinpoint the biopsy location, the doctor will numb the targeted area with an injection of local anesthetic. He or she will make a small incision and insert a special vacuum-assisted needle to gently withdraw the suspicious tissue. This tissue will be sent to the pathologist to determine if it is benign or cancerous. A small titanium marker, which is easily accepted by breast tissue, may be inserted at the biopsy site for future reference. The marker cannot be felt, and since it's not magnetized, it will not set off metal detectors or be cause for concern if you need an MRI or other imaging procedure in the future. Instead of stitches, we will use steri-strips to keep the edges of the incision together while it heals. These small strips of tape are easier to care for than stitches. They also reduce scarring. We also will place a pressure dressing on top of the steri-strips and wrap the area with an ACE bandage to help reduce swelling. As an alternative to the ACE wrap, you can bring a sports bra. We will provide an ice pack for you to apply to the biopsy site to reduce swelling. You can go home immediately after the procedure, but will need someone else to drive you. Once you get home, apply an ice pack to the incision site for 24 hours to reduce swelling and pain. Keep the dressing dry and leave it on for 48 hours. Change the dressing only if it becomes saturated. After 48 hours, you may remove the dressing, but not the steri strips. Those stay on until you see your surgeon for your follow-up visit. It's normal to feel some pain and see some bruising. However, call your doctor immediately if you have any of the following: fever greater than 101 degrees Fahrenheit, severe or increasing pain, redness or increased swelling at the site of the incision, excessive bleeding at the site, drainage lasting more than 1 day. We have printed these instructions for you so you have them for easy reference. The results of your biopsy will be available within 5 days and will be given to the doctor who referred you. He or she will discuss the results with you during your follow-up visit. As always, if you have any questions or concerns, please don't hesitate to call the Breast Health Center at Wilton Medical Arts.
The recovery really wasn't a big deal. If anything, it's the waiting that creates the anxiety. But a few days after my procedure, I got the good news that the biopsy was fine. What's most important is to stay on top of it and have regular mammograms. If there's the least bit of change, just remember they're being cautious and it's better to have it checked out.